In a world that never slows down, it's easy to dismiss feeling tired as just another part of modern life. We see our bodies working perfectly, a complex system running smoothly, like the effortless flow of blood cells through our veins. But what happens when this internal river is disturbed? You might brush off persistent fatigue as stress, or overlook a few unusual marks as simple clumsiness. Are these just minor inconveniences? Or could they be your body's quiet way of signaling something more profound? Many blood disorders begin with subtle, easily ignored signs, whispers from within that deserve our attention. It's crucial to understand these signals, as recognizing them early can make all the difference in maintaining your health and well-being. One of the most common yet frequently misinterpreted signs is a deep, unshakable fatigue, often a hallmark of anemia. Imagine trying to get through your day, but even simple tasks like making coffee feel like monumental efforts. You look in the mirror and notice your skin is paler than usual, almost ashen. This isn't just about feeling sleepy, it's a profound exhaustion that sleep doesn't fix. This pervasive tiredness happens because your body has a lower than normal number of healthy red blood cells, which are responsible for carrying vital oxygen to your tissues. When your organs don't get enough oxygen, they can't function optimally, leading to symptoms like shortness of breath after minimal exertion, such as climbing a single flight of stairs. You might also experience dizziness, cold hands and feet, or even strange cravings for non-food items like ice or dirt, a condition known as pica. Then there are the marks that appear without a clear cause. You might find bruises on your arms or legs and have no memory of bumping into anything. Or perhaps you notice tiny pinpoint red or purple spots on your skin, known as petechiae. These unexplained marks can be a sign of a platelet disorder, such as thrombocytopenia. Platelets are tiny blood cells that help your body form clots to stop bleeding. When you don't have enough of them, or they aren't working correctly, even minor impacts can result in significant bruising. Other telltale symptoms include frequent or prolonged nosebleeds that are difficult to stop, bleeding gums when you brush your teeth, or a small cut that seems to ooze for far longer than it should. These are your body's warnings that its natural defense against bleeding is compromised. Sometimes the signs are not on your skin, but reveal themselves in more dramatic ways, pointing towards mild clotting disorders like von Willebrand disease. You might undergo a minor dental procedure, like a tooth extraction, and experience bleeding that is unexpectedly heavy and difficult to control. This occurs because the proteins in your blood needed for a stable clot are either deficient or defective. The clotting process, a complex cascade of events, fails at a critical step. This can also manifest as large, deep bruises that form from very minor bumps or unexplained swelling and pain in your joints, which can be caused by internal bleeding. These symptoms aren't just part of life. They are significant indicators that your body's clotting mechanism isn't functioning as it should, putting you at risk for more serious bleeding episodes. Your body communicates in a language of its own, through subtle feelings and faint marks that are easy to overlook in our busy lives. Persistent exhaustion, unexplained bruises, and unusual bleeding are not symptoms to be ignored. They are important messages that warrant further investigation. Listening to these signals and seeking timely medical advice is a powerful act of self-care. A simple conversation with your doctor and a series of blood tests can provide clarity and peace of mind. Catching a potential issue early opens the door to effective management and treatment, allowing you to move from a state of worry to one of relief and renewed health. Don't dismiss the whispers. Your body is trying to tell you something important.